Thank you, Rebecca, and good morning, everyone. South Dakota's Department of Health has thrived on providing South Dakota residents and the media the most updated COVID-19 information as it becomes available. To that end, here's the latest statewide COVID-19 numbers. New confirmed cases, 111. New probable cases, 64. Active infections, 2,151. Recovered cases, 105,614. Currently hospitalized, 109. Total tests performed, 903,230, with total persons tested for 409,641 unique persons, 109,580 positive cases, and 300,061 negative persons. We continue using the RT-PCR positivity rate since that measure is being used by the CDC as well as CMS for nursing home and long-term care facility reopening plans. The last 7-day number as of this morning is 6.7%. Additionally, 129,541 doses have been administered to 89,050 state residents. As a reminder, this provisional data is reported. And can be found on our COVID-19 dashboard, which is updated daily, and it's found at doh.sd.gov. I also want to take the opportunity to invite the public to use the many info tools our department has released in the past few weeks to get the relevant information that best helps residents and their families combat COVID-19. Again, all of this can be found at doh.sd.gov. And with that, I will now turn it over to our state epidemiologist, Dr. Joshua Clayton.
All right. Thank you, Daniel, for those updated COVID-19 numbers. To give you a little bit of perspective, our COVID-19 case numbers do continue to decrease. For the past 7 days, we've seen about 950 total cases. This is an 8% decrease from the prior 7-day period. We had a little over 1,000 cases. We also see that in comparison to the vast majority of states, our case rate and our death rate are well below most other states. That information can be found at the CDC COVID tracker site, and we'll see kind of what those case rates and what those death rates are updated also on a daily basis. The South Dakota Department of Health has updated the Your Health section of the Department of Health's COVID-19 website to show the 43 sites across the state where persons infected with COVID-19 can receive monoclonal antibody treatment. Now, just a quick reminder that antibody treatment is used to help your immune system fight off the SARS-CoV-2 virus, and that persons that are eligible are those that have mild to moderate COVID-19 infection who have tested positive SARS-CoV-2 virus 10 days of their symptom onset, and they're at least 12 years of age and weigh at least 88 pounds, and that they are also, due to some of their underlying medical conditions, that we're progressing to severe COVID-19 infection that may include hospitalization. The other update that I wanted to provide today is perspective of dashboard updates related to our vaccination data. So on the vaccine tab, you'll see that we've added the percentage of South Dakota residents who are eligible for the COVID-19 vaccine, and that is as the 1-dose coverage as well as the 2-dose or completed series coverage as a percentage of the total population of the state that's eligible, which are individuals aged 16 years of age and older. And so take a look at that information as another way of keeping track of how the state is doing with our vaccine rollout. So with that, I will now turn it over to Secretary of Health, Kim Malsom-Ryerson.
Thank you, Josh, for that update. Good morning to all of you who are joining us. Before I get into some of the updates that are new this week, to highlight that since the beginning of this, we've vaccinated over 40,000 people with both doses and given 129,000 South Dakotans at least one of the doses of the vaccine. So we continue to make significant progress, and our state remains in a strong position nationally in this effort. As our vaccine allocation increases, we'll only be in a better position going forward. So, relative to the allocation, this week our weekly allocation is 13,550 doses, and that's a 5.4% increase over last week. So that's obviously good news as we're working to get the other update is that we're really pleased to share that the federal retail pharmacy program for COVID-19 vaccinations will be beginning tomorrow in South Dakota. So we understand from the federal government that there will be 13 initial retail pharmacy locations that will be activated. The doses are relatively limited at 2,600 across these locations, but again, we're really pleased to have more partners out there and more vaccines available. The pharmacies that will be participating include Walmart locations, IV locations, Lewis Drug locations, and pharmacies that are supplied by Cardinal Health. So this is just the initial allocation and initial activation of this program, and so we expect more locations will come online as supply allows. And so all of those who have registered for this briefing will get a retail pharmacy location map and further details for your audiences after this briefing. It's important to note that all participating pharmacies will be following the state's vaccination plan so that we have a consistent approach across the state. And again, we just appreciate the fact that there will be increased access points to make vaccination even easier and more convenient for people in our state. The other update that I wanted to provide today is also exciting news in that now that we're seeing increased access points for vaccination and our allocation increasing slightly, we are announcing that starting next week, we will be dropping the age of those who can get vaccinated to those people who are 70 and older. So again, immediately following this briefing, everybody who registered will get an updated infographic that you can feel free to distribute, and we appreciate your help with that. So we're confident that the adjustment that we're going to be making, will be continue to help us get folks vaccinated, and again, really protecting those people in those vulnerable age groups. Just want to make sure that you all are aware and are helping us get the word out that we do have a tool available on the covid.sd.gov website for people to figure out what priority group they are in. And so thank you for helping us get that out so that people that have questions about when it's their turn to become vaccinated have the benefit of that information. The other point I want to make is something that you've heard me say before, and while we continue to work very, very hard on vaccination, we can't let up on testing for COVID-19. And so we have a free, at-home, convenient option that South Dakota residents can go online, order their saliva-based test, have it at home for when they need it, and get results in a timely way. And so we really need people to continue to take precautions, and testing is part of the overall response that we can't let up on. So that testing and vaccination really are going to be the keys to ending this pandemic, and we're looking forward to the day when we can declare that over. So with that concludes my briefing.
Okay. Thank you, Secretary Molson Risden and Dr. Josh Clayton. At this time, we will open the floor for any questions. If you would please identify yourself, your media outlet, and then ask your question. Who would like to ask the first question?
Eric Mayer, KLN News.
Go ahead, Eric.
Awesome. I'm glad you mentioned testing. That was kind of my question today. You know, if you just look at the testing goals, it was passed by 345% in December, down to 242 in January, and 45% so far in February. Is the federal government looking at changing the testing goal, or what needs to kind of happen with testing since it's more available than ever, but fewer people are doing it?
Well, Eric, thank you for that question. Just a reminder that the goal that you see out on the website is associated with the federal grant that we have to support those testing efforts. And so, early on, we established a a goal of testing at least 5% of the population in a given month. And so, and just really kind of seeing that level of testing happen. We obviously want to see that much higher so that, again, we're identifying people that have COVID, helping them isolate and not spread it to others, because that's a key aspect of the response. So to your second point about, testing is more available than ever, I think you're exactly right. And again, making this available at no cost, making it convenient so that people can access it at home through the saliva test or through their regular provider. We've done mass testing in the past. I mean, there's a lot of ways that people can be tested, and I think it's just important that people remember that is important still. That we shouldn't just assume that it's a cold. If you have symptoms of COVID, you should be tested because it's important that you isolate if you're positive. And so, thank you for helping us get that word out about the importance, because we're not over the hump yet in regards to COVID.
Okay. Next question, please. Can we please have the next question?
Jody Heemster, Dakota Radio Group here.
I heard Jody.
Just wondering about an update on the volunteer portal. What kind of response are we seeing, and how's that working out so far?
Jody, well, thank you for asking about that. We have had a great response so far. We'll pull up the latest numbers because we're literally getting people signing up every single day. And so we have, just as a reminder, the opportunity is for people that have a medical background in terms of being able to actually vaccinate people, as well as people that don't have that kind of background but would be available and would like to help with the logistics of helping with some of our vaccination clinics. Obviously, the need for volunteers will be there when we see a larger vaccine allocation to the state. But we also want people to sign up now so that if they want to become vaccinated themselves before volunteering, we have time to do that. So as of this morning, we had just over 2,800 people sign up, 2,862. And we'll be, the systems that are doing the vaccination during this phase, we'll be reaching out to those people just to let them know, that we have their information and that when ready for those kinds of events, that they may be called on.
Next question, please.
This is Jerry at WNAX in Yankton.
I heard Justin. Maybe I heard.
Go ahead, Jerry.
Jerry.
Thanks, JP. So, with the, we're still getting questions, and there's confusion on the vaccination availability. And you mentioned the other pharmacies that'll be getting it, spreading it out. Is there any thought of maybe doing a portal on the COVID website where people could have a one-stop for that? Some states are doing that. Nebraska, for instance, a very clean, easy-to-register portal would help people with getting in line and understanding when their shots are scheduled.
So, Jerry, what you can help us inform people about is on the website we have a map of the state. Like on the county where you live, it'll take you right to where you can sign up. And so it's not a one portal, it's a portal that's linked to the actual entities that will be doing the vaccination in those counties. We do encourage people to do that proactively. And so, next week we'll be able to start vaccinating people that are 70 and above. But if, there's folks that are younger than that want to, kind of add their name to the list, we encourage that so that as we get the vaccine into the state, we're able to schedule those appointments and get people in.
Okay. I believe we had another question out there.
Yes, JP at KORN News Radio.
Go ahead, JP.
Thank you very much. Hey, could you give us an update on the allocations that are coming into the state? Are we getting more, or are we still holding steady?
Sure. So this week we're seeing a 5.4% increase. So that is, good news, obviously. And let me find the exact number for you. This week our allocation is 13,550 doses at the state level. Plus, we'll see the 2,600 doses through those retail pharmacy partners.
Next question, please. Next question,
Jonathan
please.
from the Arts Leader.
Go ahead, Jonathan.
Thank you. Hey, just a question in terms of the vaccination rates. They seem to decrease fairly significantly over the weekends, and I'm just wondering if that is a reflection of the state using up its allocated vaccines, or a reporting lag, or or your partners in vaccination taking the weekends off?
Well, Jonathan, I'll turn it over to Josh here in a second. I can tell you that the way the process works, if you will, is we're informed at the state, at the state level every Tuesday what we're going to see for doses the following week. We make that order on Thursday. Sometimes we see that actually delivered on Fridays. Other times we don't see it delivered until Monday or even Tuesday. So the delivery schedule really impacts how quickly we can get shots in arms. And so when we see earlier deliveries of the week's doses, they're getting clinics done earlier in the week.
And this is Dr. Clayton. What I would also say is, not only kind of the timing of the vaccine that's available, sometimes these are second doses, and so, that's specifically focused to try and get individuals in. And so, we do see that effort being a little bit more directed to those individuals that need that, and so it extends sometimes, beyond the week into the weekend and so on. But I think those phase 1 vaccinators that we're working with are trying to just maximize the staffing that they have, as well as convenience for individuals to get vaccinated.
But I can tell you that vaccination is happening on the weekends, and so.
Okay. Next question, please.
Jack Cottle, KEVN and KOTA.
Go ahead, Jack.
What is the latest on the variants here in the state? Have we found any of them here, and how much testing is being done here for them?
Yeah, thanks, Jack. This is Dr. Clayton. We do continue to conduct surveillance for those variants. We have, in addition to the CDC collaboration that we have for submitting specimens to them on a biweekly basis, we're also doing testing in-house to identify variants. I don't know the total number, but we have started and done at least 48 specimens last week to kind of kick off our surveillance in-state, as well as sending at least 10 specimens every 2 weeks, so at least 20 specimens a month to CDC as part of that representative sampling that they're doing of states for sequences. Now, through all of that testing, we have not identified either the B117 or the B1351 or the P1. All of those variants have not been identified in the state. We have seen variants identified in surrounding states of Minnesota, Iowa, and Wyoming. In all three of those states, the B117 variant, which is also termed the UK variant, has been identified, and only in Minnesota has the P1 variant been identified, the variant that had originated from Brazil.
Okay. Next question, please.
Forgive me, Ray from Kettleland. Just want a little explanation, because I think I misunderstood the vaccinations distributed by pharmacies, how folks would sign up for those. And forgive me, because I may have misunderstood or missed it. Thank you.
So what everybody that's registered for this call will be getting right afterwards is the updated map that shows the locations of those retail pharmacies that will be part of that initial rollout. And when you click on the map, you'll be taken to the link for those particular pharmacies, and they've got online resources to sign up for vaccines there. So very similar to our phase 1 vaccinators. And again, we'll continue to make that information available so that people can find, locations that are convenient to them.
Okay. Next question, please. Hearing no more questions, we would like to thank you for joining us today. If you